Talk about Hirschsprung disease. It is a congenital disorder, so it means that it will be present in the newborn. And in Hirschsprung disease, mainly like what happens is that there is collapse of the distal portion of the colon. And the reason for this is because of the absent ganglion cells in the internal nervous system, and it is affected part remains collapsed. So now this part is mostly like the distal part is involved, and it will be collapsed. Here it's really looking abnormal, like this area is dilated, and this area is collapsed, and because this area is affected, and the reason for that is because of the absent ganglion cells. And so let's talk in a little more detail about the ganglion cells. So in order to understand the ganglion cells, we have to look at a bit of the astrology of the GI tract. And so what happens in the GI tract is that if this is an intestine, let's say duodenum, or can be the colon, the transverse colon, for example, and then we take a cut section through one of its wall, then the first layer, towards the lumen. So if this is the lumen, the first layer that we're going to encounter is called the mucosa, and just basically involves the epithelium and the basement membrane. And then below that will be, or outside that, there will be another layer, and that is the submucosa. And it is in the submucosa that there will be a nerve plexus, just a bunch of nerves, and with cells called the ganglion cells. So if this is a ganglion cell, this is another ganglion cell, another ganglion cells. So this all makes the submucosal or the Meissner plexus. And the job of the Meissner plexus is to secrete fluid into the lumen. So it's, for example, it releases the acetylcholine, and the acetylcholine kind of increases the secretions of the intestine because there are glands here that help in the digestion of food and all of that. So it assists in the secretion of the fluids. Okay. Outside the submucosa is the Muscularis Externa. So this, let's say, is the Muscularis Externa, and it has two layers. So the first, which is the inner layer, it is a circular, and outside is in the Muscularis Externa is the outer longitudinal layer. So outer longitudinal, inner circular, and between them is another plexus. It's called the myenteric plexus. So in the Muscularis Externa, we have the myenteric plexus. In the submucosa, we have the submucosal, the Meissner plexus. And the job of the Meissner plexus we already talked about is to secrete fluid, while the job of the myenteric plexus is motility. Okay, it helps in the contraction of these muscles so that the gut motility is regulated. So outside that, two things could be happening. So if the intestine is intraperitoneal, then there will be adventitia. If it's not intraperitoneal, it's extraperitoneal, then it will be adventitia. Okay, so this was just the general histology. So now you can imagine if the ganglion cells here and ganglion cells here in the Meissner and the myenteric plexus are absent, then the fluids here will not be regulated, and also the motility will not be regulated, and that will result in a collapse of the affected part of the intestine, which is mostly the distal part in Hirschsprung disease. And so that is just the mechanism of how it all happens. So now we say here that it is a congenital disorder, and there are no ganglion cells in the internal nervous system affecting the distal colon, and affected part remains collapsed. That's important to know. Then the pathogenesis, there will be failure of neurocrest cell migration. So the migration words is really important to know, and neurocrest cells are also really important to know. The derivatives of the neurocrest cells, for example, melanocytes and all of that, is really important to know for exam purposes. And also the neurocrest migration, the migration is defective here, so that's also important. And then it is the involved genetic mutation is the RET mutation, and is a lack of function mutation. Okay. Then coming down to the clinical features. So now you can imagine when there is a collapse of this part of the intestine, the meconium, which is the first stool of the baby, will not be passed, and it will accumulate here. And when it accumulates here, it will cause distension of the abdomen, right? So abdominal distension is one, that's easy to know. then there will be constipation. It's a no-brainer because there is collapse of the intestine, so there will be no meconium in the first 48 hours. In the first 48 hours, there will be no meconium because of the collapse. And then the third thing is biliary emesis. So let's talk about that in a bit more. So if we have a stomach here, and then the duodenum that comes here like this, and like this, and then we have the pancreas here, and from the pancreas there is like a gallbladder here, and then the pancreatic duct, and it empties here the bile. So now from the liver, the bile comes down and it joins the pancreatic duct, and then the bile and the pancreatic fluid, the juices are kind of secreted here. So now if the obstruction is above this area, above the duodenum, the second part of the duodenum here, like above the area where the bile duct enter the intestine, the Hirschsprung duct, the duct of Hirschsprung, enter the duodenum or the intestine. If it's above that, then obviously there will be no bile in it, and so it will not be a biliary emesis. But here in the disorder that we're talking about, there is a distal obstruction, right? There is like the area that is closer to the anus, that area is affected, and so when that is affected, the bile will be secreted, and so the emesis or the vomiting will be biliary emesis. Okay. Then another important thing to be aware of is that the disease, the Hirschsprung disease, is associated with Down syndrome, and then the treatment is surgical. And so how does that happen? How does that work? And so the affected part, the part where there are no ganglion cells, for example, this part, it will be cut. Okay. So this area is cut, and these two are joined. And so then, because this area, these are all normal, so the function will be back to normal. So this was just a discussion about the Hirschsprung disease, really important to know, and I hope it was helpful.